organisms and their parts. It is a branch of biology and medicine. People who study anatomy study the body, how it is made up, and how it works. The study of anatomy dates back more than 2,000 years, to the ancient Greeks. There are two main branches of anatomy. Gross anatomy, also known as macroscopic anatomy, is the study of structures that can be seen with the naked eye. This includes bones, muscles, organs, and blood vessels. Microscopic anatomy, also known as histology, is the study of structures that are too small to be seen with the naked eye. This includes cells and tissues. Branches of gross anatomy. Regional anatomy is the study of the anatomy of specific body regions, such as the head, neck, thorax, abdomen, pelvis, and limbs. Systemic anatomy is the study of the anatomy of the body's organ systems, such as the cardiovascular system, respiratory system, digestive system, and nervous system. Surface anatomy is the study of the landmarks and structures that can be felt or seen on the surface of the body. Branches of microscopic anatomy. Histology is the study of the structure of tissues. Cytology is the study of the structure of cells. Embryology is the study of the development of organisms from the embryo to the adult. Anatomy is an important subject for many different healthcare professionals, including doctors, nurses, physical therapists, and dentists. It is also a subject that is studied by many students in biology and other related fields. Here are some examples of how anatomy is used in the real world. Surgeons use their knowledge of anatomy to perform complex operations. Radiologists use their knowledge of anatomy to interpret medical images, such as X-rays and MRI scans. Physical therapists use their knowledge of anatomy to help patients regain movement and function after an injury or surgery. Artists use their knowledge of anatomy to create realistic and accurate depictions of the human body. Anatomy is a fascinating and important subject that helps us to understand how the human body works.